us on this Power Hour. Today we're going to be discussing breathing and the interactions between the spine and the ribs and how they can affect your breathing. My name's Andy, I'm a physio. I'm joined by Naseem.
Hi there.
So I guess if we start off by maybe just discussing, how the ribs and the spine can affect the breathing. So, Naseem, how important are they for effective breathing?
Well, the ribs and the spine are extremely important for effective breathing. They work together to produce an effective breathing mechanism. For the ribs and the rib cage attach onto the back of the spine, and lots of different kind of movements that a person does with their spine affect the way the rib cage works as well. So if there is a restriction in the spine or the ribs, that will affect the way someone's able to breathe. It's also important to know that if a person has a problem with their spine, it's very likely that they also will have some sort of breathing issue. So it might not be so apparent to a person, but as an osteopath, I would always look at the way the ribs are working if someone comes and presents to my clinic with back pain. It can indeed affect the person breathes and vice versa.
And when would this normally start? So, what would be the difference in someone who has their breathing affected, or versus doesn't? So, where would you normally treat, and what sort of things would you like to work on to try to improve them?
Well, as an osteopath, it's really important to look at the spine first of all. The spine is the center of the body, and it holds everything in place. Once you get that moving sufficiently enough, then everything else starts to move a little bit more easily. The other thing is I also like to focus on the mechanics themselves of the breathing. So the diaphragm especially is really important for pulling down the ribs and allowing for increased amount of movement in the ribs, and helps to get plenty of air into the lungs. And if there's an issue with the diaphragm, let's say someone has issues with their upper back, for example, the most reason they would have an issue with their upper back is because they're not utilizing the diaphragm. So by encouraging and stimulating to move effectively, what it will do is it will effectively encourage more motion into that lower rib cage, and that in turn encourages a greater amount of movement of air into the lungs.
It's something that I would have seen quite commonly when I used to work in respiratory, would be people who have difficulty breathing, and they get, like you said, they use their upper back a lot more, so they start to breathe in and up. And that in itself, what sort of problems can that lead on to?
Well, by breathing in into the upper back and shoulders, what it causes is it causes what's called an equal type of breathing. So that means that all that movement is basically happening at the top of the ribs, and as opposed to lower down where it should be happening. And that in turn can tighten all those muscles around the neck and the upper back and shoulders. And when you have those muscles becoming really tight, it restricts the movement of the neck and the spine as well. And then you get a lot of other issues because of that. You can get some problems with the muscles being strained. You can also get problems with the neck, for example, being inside the joints. because they're working to basically move the neck through certain movements as opposed to utilizing the muscles, because the muscles are too busy working to encourage the breathing. The other thing is that if someone's breathing more from the upper back and shoulders, what it's going to do is it's going to affect their posture. And then we will know that issues with posture can severely one's ability to work. So the kind of effects of breathing on a person's body can, severely impact their day-to-day quality of life.
It's really one of those things that they kind of feed into each other as well, because you start to get the problems with the upper back and the neck pain, and that affects your posture. And then again, your posture limits your lung capacity. So if you're in a slightly different position, it's much harder to use that diaphragm. It's much harder to take those deep breaths in. It's harder to open everything up and get more airflow in. And you end up working a lot harder just to take those small short breaths in, and everything becomes a bit more tired and sore as well on top of that.
Exactly.
So with it, I mean, what sort of conditions would you normally see, and what sort of people would you normally help with their breathing?
Well, there are a number of conditions that are related to breathing. The most common of those conditions is asthma. Now, what happens with asthma is it restricts the amount of airflow going into the lungs. You have the tube of the airways, okay, and then inside the tube you get build-up of mucus, and what it does is it causes a little bit of inflammation, and that causes the constriction of the airways, and that restricts the amount of airflow in. It's a lot more challenging to be able to inhale and breathe in, and also to exhale and breathe out. Now, with patients with asthma, for example, what tends to be the normal kind of breathing for them is they tend to use the upper back and shoulders, and that can severely impact someone's life. So they end up with a lot of issues in the neck and also the shoulders and upper back. Now, the way that a person can kind of help themselves with asthma in particular is they can basically work to exercise quite a lot, and trying to keep inside their limits whilst they're exercising. But what it does is it creates that pressure behind the airflow, and it helps to kind of move the fluids from the airways out of the lungs. Now, you're experts on exercise as well. So, what do you think is kind of the better kind of exercises that you can do to kind of help things?
I think you hit it pretty spot on. It's certainly with asthma, like you said, you can get the mucus, a slight increase in secretions in the lungs, but you can also have the spasm on top. So not everyone with asthma will get a productive cough where they're coughing up things all the time, but they might feel that they can't take as deep breaths in, that possibly because of the spasm, and that's what your blue inhaler does, is it helps relax that spasm so you can get some more air in. So it's really important to be smart with your inhaler use, and speak to your doctor, your nurse, anyone who's looking after your prescription with that, and best advice how to use that, and let them know if you're looking to increase your exercise level, because they're the people that are managing this, and they're helping to manage the spasm with that. In terms of secretions, and when you exercise, like you said, it does a few things. So someone is feeling a bit blocked up, and they're manageable. And this is particularly helpful for things that have a lot of fluid in the lungs. Like a good example would be smokers, anyone who's basically got COPD, chronic obstructive pulmonary disease, which is basically you have these mucus plugs. So you have in your lungs loads of small airways. They go from big down to small. What can happen is over time, the damage caused by the smoking can cause you to produce an extra amount of fluid, secretions really, and they can basically block some airways in there. But your body's designed in a very clever way in which, even though there might be a blockage, air is able to get behind it. So there's basically cross channels, so back roads. So if I take a deep breath in, the air will come down another direction, and then we'll be able to migrate behind the blockage and help to move it back up. So that's a really, really effective way to kind of clear those, because having the air in can help move things up. So in terms of anyone with really struggling with productive cough, exercise is really good because it can help get an air in behind, open up those airways and move things along. But also if things aren't quite blocked and it's just a little bit of secretion sitting on the lung, the fast movements, when you're breathing, the huffing, the exhale, can help shear some of that mucus off. I think we're all probably slightly more aware about how droplets are kind of spread around now in the situation we're in, but that does happen. So your lungs do produce a certain amount of aerosols when you breathe. Breathing out heavier produces more aerosols. And that can be really advantageous for anyone who's got some fluid in their lungs that need to basically move it. I say fluid secretions, or use a better term. On top of that, the general benefits from exercise for lung health are huge. You're using all those muscles that you were saying. You're trying to be efficient and effective. So when you're really trying to push your body, you will find a more natural breathing pattern. So try to get out of that upper back breathing and try to take your deeper breaths, because you have to, because if you can't breathe when you're exercising.
Exactly.
But also exercise itself is in essence slightly anti-inflammatory. So some of the stimuluses that the chemicals inside your body that are produced with exercise do have essentially an opposite effect to some of the things that happen when you smoke. So exercise is really good for your general lung health, your overall lung health, and improving those things that you're looking to improve. Do you have any questions with
that? So with the asthma,
yeah.
So there's also that element of when you're exercising, you're creating adrenaline as well, and that in turn can also, help to dilate and those constricted airways as well, and that just also helps with that, doesn't it?
Mm-hmm. I mean, in general, exercise does help things relax, and with asthma, you do have to be careful, because you don't want to get your body trapped in a rock and a hard place. If there's a spasm there and you force it too much, it may not release the spasm at all, and that's essentially one of the big problems is. So it is grading into things, taking things at a pace that's comfortable for you, smart use of your inhalers, then you'll get the added effect of the exercise on top of that and help things to basically hopefully modify the amount of spasm within the lungs so you can get more air in. I guess I have got another question for you, really. What sort of things would you do with someone who comes in with some of these conditions? So how can you help?
Yeah, with asthma and COPD and a lot of airway conditions, and manual therapy in general can help to increase the amount of mobility in the rib cage. This in turn will increase the volume inside the rib cage, and that helps to increase the amount of airflow that can be inhaled into the lungs. To create enough airflow in the lungs, what a person needs to do is to create enough space in the lungs to be able to pull in all that air outside into the lungs. And by doing that, what you're doing is you're going to increase the amount of oxygen that's able to be basically taken into the body and the bloodstream, and that in turn will help to oxygenate all those organs and muscles in our body. And then what that will do is it will give us a healthy kind of outcome. So all those organs and muscles and everything, they need plenty of oxygen to survive and to be able to function efficiently and properly. So breathing can play quite a big role in a lot of chronic conditions. So by improving mobility inside the lungs, inside the rib cage rather, what it will do is it will encourage greater amount of airflow into the lungs. What I
really is.
Sorry.
Sorry, I was going to jump off your point there. It really is one of the most important things for just general health, and we always it's one of the most frustrating things when someone says to you, just take a nice deep breath, and you just can't do it. When you're quite stressed and worried, it just kind of feed into all these things, and that does help restrict your breathing, and doing some of the work around those areas to help things relax and help you take those deep breaths in and then try to manage your stress better is really important. And there are certain breathing techniques that we do just to help you manage stress. But unfortunately, if you can't get in enough air when you do them, it's quite hard to hold the exhalation for a certain period of time. Again, my experience from breathing difficulties is mostly hospital based, and the techniques we do there are slightly different. But then again, if someone's in hospital with breathing, and they're in a slightly different position. So what sort of techniques, and how would you apply the techniques that you've learned with someone who has some difficulty taking those deep breaths in?
Well, a lot of it is down to a person's mindset. As you mentioned, it's a lot of it's down to stress. So when you're able to get into the mind of a patient, and you're there to kind of help them to be able to focus their body on that lower area of their lungs and rib cage, what it does, it allows them to take control over their breathing. So it's really important to educate the patient on the importance of breathing lower down. It's also important for the patient to understand that it's important to take time out in the day to focus on breathing through the diaphragm and the lower part of the rib cage. What I tend to do is, in treatments especially, is ask the patient to breathe, lower down into their rib cage, and then as they understand how it feels, it becomes like a routine. So it changes the way the body is able to breathe normally, and that way, over time, what happens is they, instead of breathing up from the neck, they end up breathing more from the lower abdomen and diaphragm, where it should be happening. And what tends to happen is their neck pain and back pain tends to go away after that. So I think it's really important that persons, focusing on their own breathing and taking time to look at that themselves.
I think it's really interesting. And what sort of advice would you? Because it's a very hard thing to feel sometimes.
It is, yeah.
Yeah, we all breathe automatically when I'm thinking about it. Hopefully. So when you are trying to change the way you're breathing, what sort of things would you say to someone who you're trying to help them breathe through the diaphragm a bit more? If you're saying.
So try and focus the breathing on inflating their stomach, as opposed to focusing on the upper chest. So that a person's able to do that is to close their eyes and just relax into their breathing, and then once they're more relaxed, they automatically tend to focus on breathing lower down into the abdomen. And quite helpful is using one of these apps, which are readily available as well. One of these breathing exercise apps, and they're quite a lot out there. What it can do is it can help to focus the mind on the breathing technique, and just encourage a better way of breathing. Yeah.
And with So it's kind of two things, like I said, trying to encourage that diaphragm being a bit more. But is there any advice you'd give to someone who's looking to maybe settle the upper back, the shoulders, and the chest in a bit to make that a bit more effective? Is there anything you could do possibly before you did the diaphragm exercises that would loosen things up or help you get a bit less kind of restriction from that kind of bucket handle type of movement?
Yeah, absolutely. So what I also tend to do is focus on giving plenty of stretches on the upper neck and shoulder and the muscles through here, and also mobilizing those joints attached from the ribs onto the upper back, and that can also affect the nervous system as well. Now, breathing is also one of those mechanisms which involves the ribs, which involves the nerves of the ribs, and that can play quite a big effect on stress levels as well. So we have in osteopathy a technique called rib raising. Okay, so it is what it sounds like. So you're basically raising the ribs, and what that does is it basically mobilizes those joints which attach from the ribs onto the spine, and that can affect the nervous system and reduce stress quite a lot. And a lot of patients have reported, a lot of relief in their stress levels after those sort of treatments. So that can also, be much more effective, just increasing mobility by tackling the root cause of the kind of restrictions. So the stress and environmental factors that can help quite a bit to encourage better breathing more long term. Because as we know, there's no point in just treating. You have to kind of treat the root cause of the issue, and then long term that prevents that issue from coming back.
And when do you think someone should, look and come to see one of the breathing? What sort of signs or symptoms would you be getting that would maybe lead you to think that I could use a bit of help or benefit from working on my breathing?
Well, a lot of patients who live with upper back pain, they don't really notice that they have problems with their ribs. And I always have a look and examine the ribs whenever there's a patient with spinal issues, because undoubtedly the restrictions in the spine are going to affect the restrictions in the rib cage and vice versa. So I always recommend, patients with general back pain to kind of focus on the breathing mechanics. What can happen is we can treat the symptom of the back pain, but if the root cause is the ribs and the rib cage and those muscles associated with that, unless we, tackle that as a treatment and focus on that, pain will not get better. So it is important with these issues to kind of find the root cause, and then patients get better much quicker and keeps the pain away, for a long-term effect.
And sorry, I'll always say last question, and then I'll think of something else to ask you. How does someone normally start off getting an issue with the ribs directly? Is it something from a fall, sports injury, skiing accidents, things like that? What would be the most common cause of someone coming in with probably, like I said, a local rib issue, that you need to do some of the rib springing on and some mobilization work?
Well, a lot of patients will, come into clinic, saying that they might have strained muscle, doing too much with kind of weight training and things like that. That can definitely have an effect on the muscles around the area. But the root cause of that would be, because their ribs aren't moving as they should be, or their spine isn't moving as it should be. Once you get much more mobility in areas, it will allow for a person to get into weight training without pulling those intercostal muscles, for example. So I think it's really important that people focus on mobility first, especially when they're training up, and then focus on strengthening after that.
They really calm everything down and then build it back up.
Exactly, yeah. Get that flexibility first and then get that strength in afterwards.
Is there anything else that you'd like to kind of add? Anything else you'd like to go over, or anything else you'd like to discuss?
I think it's also important to mention that patients with, inflammatory conditions in their airways, like let's say COPD, things like that, asthma, a lot of it can also be helped quite a bit with nutrition. So nutrition, if you want to focus on that, you need to have a anti-inflammatory diet. So cut lots of sugar, things like that can help tremendously with encouraging a better kind of system. So it's always important to have that holistic approach when it comes to with airways. And then once you've tackled that holistically, so looking at your own nutrition and things like that can affect the long-term outcome of that person. So it's really important to look at other environmental factors.
Yeah, it's really nice. I guess lung health isn't only the only way. It's not the only way to look after your lungs, but looking after your lungs, you have to look after yourself and look after everything else, because I said what's going into the system is important for making the system nice and healthy. Perfect, and I think we've covered everything that we wanted to cover.
Yeah, great.
Thank you for answering all the questions, Asim. I know this is mostly your area of speciality. But I guess if anyone does have any questions or would like to speak to myself or Nasim, feel free to message us on Facebook, and we'll be able to get back to you through them. Yeah, great. Thank you, everyone.
Take care. Bye-bye.
Nice day. Bye.